Welcome to the Azul Optics Quick Start series. So first of all, let's take a look at the examination from the patient's perspective. When a patient looks into the MPI, they will see a circle of white light. If they look at the center of the light and relax their focus, they will be able to observe a rotating yellow shadow that looks like a bow tie. These are Heidinger's brushes, and they're caused by the interaction of polarized light with the macular pigments at the back of the eye. The more dense a patient's macular pigments, the stronger they will see Heidinger's brushes. The examination tests how well the patient is seeing Heidinger's brushes on a scale of 1 to 10 in order to assess the patient's macular pigment density. During the examination, patients will be shown Heidinger's brushes at up to 10 different levels of intensity. Level 1 will be the easiest to see, level 10 the hardest. Those who have low macular pigment density may find Heidinger's brushes difficult to see at first, and it will disappear within 1 or 2 levels, scoring them a 1 or a 2. Those with higher macular pigment density will be able to see Heidinger's brushes more clearly to start with, and will progress further through the levels before the effect disappears. They will score between 7 and 10. Most people have not seen Heidinger's brushes before and may find them difficult to see at first. This means that it's important to manage a patient's expectations and to motivate them to relax and stay focused. Encouragement along the way can really help. Saying things like, "Well done, you're doing great, keep going, excellent," can be really helpful to a patient and help them stay focused on the task. Patients may expect Heidinger's brushes to be more obvious than they actually appear. This is particularly true with those that have low pigment density. It is important to set their expectations before they begin the examination so that they know what they're looking for. Some may feel that they cannot see the bow tie. It's important at that point, as it is throughout the test, to get them to remain calm and to encourage them to simply look at the center of the light and relax their focus. It may take a few seconds for them to learn to see the subtle effect. Some people will not see Heidinger's brushes in the white light. These people will either say that they cannot see it, or they will make mistakes at the easiest level of the examination. When this happens, the MPI will switch from white into blue. In blue mode, Heidinger's brushes will appear as a grey bow tie on a blue background. It's much easier to see Heidinger's brush in blue than in white. So much so, in fact, that once a patient moves into the blue test, they can only score 1 out of 10. We'll talk about this more when we discuss how to interpret the examination results. Some patients won't see Heidinger's brush even in the blue. This can be disconcerting for patients. When this happens, it's important to reassure them that it's okay and it's not a sign of any immediate problem. If you'd like to know why this occurs, then please consult the user documentation. When running an examination, you should bear in mind that each patient will see Heidinger's brushes slightly differently. Not only will the intensity or strength of Heidinger's brushes differ, its shape will also differ depending on the distribution of macular pigments within the eye. Some will see a small tight bow tie in the center. Some will see a larger, wider bow tie that fills the light, and others will see a gap in the center of the bow tie. So how can we tell that a patient can see the bow tie? If you ask a patient whether they can see the bow tie, then they should answer honestly. However, some will not. And so, in order to verify that the patient can see the bow tie, the MPI will alternate the direction in which the bow tie is turning, and the patient will have to identify that direction correctly. So, at each level of the examination, you will ask the patient, which way is the bow tie rotating? Of course, people can still guess if they want to, but the system will alert you to this, as we'll discuss in more detail when we talk about running the examination. You will find that some people have difficulty discerning between clockwise and anti-clockwise. So how do you overcome this? Some patients are perfectly capable of saying clockwise or anti-clockwise, but others are not. Some may prefer right or left, and others may prefer to signal the direction of rotation by making a circle in the air. It's important that you find out what each patient prefers before you start the test. When running the examination, you must remember to ask the patient to look at the center of the light. The reason that this is important is that Heidinger's brushes are a shadow of a person's own macular pigments on their retina, and so, when they move their eyes, the bow tie will move. If the patient is not looking in the center, part of Heidinger's brushes will be obscured, making it hard to tell the direction of rotation. And so to recap, Heidinger's brushes are very faint. They will appear differently to everyone. Patients will be required to identify the rotation direction. Patients must look at the center of the light. And it's important to manage expectations and provide them with encouragement throughout the examination. That's the end of this course. Thank you for watching, and if you want more information, please contact us at www.azuleoptics.com.